This patient came to see me 10 years ago for endodontic retreatment of tooth number 13. 10 years ago. So in 2013. Patient told me the root canal was done in 2007, so 6 years prior. And he was hurting. He couldn't bite down on the tooth, and he said he had pain to biting and also spontaneous throbbing pain. So you can see this looks like a start of a periapical reducency right there. Look at the post there, and of course previous root canal. Went over options with her, and she said, let's try to see if we can save it. So we went ahead and redid the root canal for her 10 years ago. So you can see right here when she was referred to me in 2013. This was immediately after I redid the root canal, so removed the post and all of that stuff, removed the GP, and redid the root canal 10 years ago. So this is immediately after I redid the root canal 10 years ago. So if I didn't have a 10-year post-op of this tooth, a lot of you would have said there's not enough tooth left, the tooth needs to be pulled, should have been pulled, or you got gaps. You got gaps. You got a gap here, you got a gap here, and you know, the root canal retreatment will fail because of all of that. But luckily, I have a 10-year post-op of this tooth that I can show you that none of this stuff matters. None of this stuff, gaps, that right there, that's a large gap. I mean, I didn't do it intentionally. It wasn't intentional. But when it happens, I don't panic. Maybe there's even overextension of maybe sealer or gutta percha here. I wasn't worried about all of that. You know why? Because I knew that I had cleaned this tooth so much that was really to the point of a sterilization. No microorganisms would survive. So these become problematic only if you leave bacteria behind. So when there's no bacteria, none of this stuff would matter. None of this stuff would matter, okay? So take a look. As you can see, 2013, 10 years ago. This is, as I said, immediately after I had redone the root canal 10 years ago. And this was just now. Patient came in so I can look at a different tooth, and we always take PAs of our work to make sure they're doing okay. 10 years post-op of tooth number 13. See, none of that stuff mattered. Gaps, and if there was extension of gutta percha or sealer, none of that stuff mattered. No periapical lucency, tooth is in full function, patient is happy, everything's good. You see there was enough tooth left, the dentist was able to put a crown on it. That small periapical lucency went away, completely healed. 10 years post-op of tooth number 13. And as you can see, here it is. It was just now, patient left just now. 10 years post-op. 10 years post-op of tooth number 13. None of that stuff matters. None of that stuff matters. Gaps, overextended gutta percha, sealer extrusion. None of that stuff matters. There you go. That's another case for you. All right. 10 years post-op of tooth number 13.